According to the Administration on Aging, today there are over 43.1 million adults aged 65 and older in the United States. Nearly 92% of older adults have at least one chronic condition, and 77% have at least two. The specialists at Better at Home and Mederi Caretenders explain the importance of medication management when it comes to treating patients with multiple conditions.
I love medication management with our patients because, especially if they're on 5 or more meds, it gets kind of confusing to them. And again, I will use myself as an example. When I get sick and I get those antibiotics, I'll take enough to feel better, and I'll save that little few to when I get sick again. That's a big no-no, and we find that our seniors do that as well, or they're not taking their meds properly, or maybe they've got macular degeneration, so they really can't read their labels, or maybe they are new onset stages of Alzheimer's and they forget to take their medicine. You know, we had a patient that every time she took a nap during the day, she napped quite a bit. She always thought it was morning when she woke up, so she would take her morning meds over and over again. So we would have to put together a medication plan for her of, at this time, this is when you take, we would map it out for her to try and make that a little bit easier for her to remember. Medication management is huge, and there's so many patients each year that die from misuse of medications, or a spouse taking an antibiotic from their other spouse. They understand the effects of all their meds that they're on. There's not any duplications in that. If we're seeing some major side effects from their medicines, we will contact their physician and maybe get them on something else or reduce it. We also utilize our occupational therapist to come in and work with our patients on med management as well. So we do med reconciliation at every start of care for our patients, and we have patients that maybe were prescribed like warfarin in the hospital, but at home they're taking Coumadin, and those are the same thing. Warfarin is the generic from Coumadin. Patient didn't know that, so they were taking both. So whenever we're out in the home, we always do a med rec to actually see what they're supposed to be taking, what they're actually taking, and then we'll put together a med management plan for them to make sure they're taking it on days that they should and at times that they should throughout the day.
For more information on services offered by Better at Home and Mederi Caretenders, click on the Medication Management Story link icon on our homepage, yourhometownhealth.com.